Dr. Moein. I'm here with one of my lovely patients, 47 years old. She has had a previous implant and one of them is deflated and she has some asymmetry. Her left breast has more ptosis, is bigger and it's sitting lower, and deflated implant that she had many years ago. So what we're going to do is we're going to go in, we're going to remove the implant, we're going to replace the implant, do a lift with her, we're going to match this side to that side so she gets some asymmetry. A lot of different variables, but we're able to achieve this in one operation. Thank you for joining. It's the first part of the procedure. This lovely lady had a silicone implant. The silicone implant has ruptured, and you can see as soon as we get into the capsule is leaking. This is what a silicone implant rupture looks like in the OR. So we're going to remove all this material, which is silicone. It's preserved within a capsule, so it doesn't leak into the tissue, contrary to what people think. But there is still a certain amount of silicone that gets absorbed within the system, which is in very minuscule doses. So there is a concern that that may cause problems. So we're going to remove all this silicone, and then we're going to replace it with a new silicone implant after we wash out the pocket and create a clean environment. Now we're inserting the implant using a Keller funnel so we can make it malleable so it can get through a small opening. So you can see how nicely the implant slides into place. So she wanted to achieve symmetry. We did a breast lift on both sides. We decreased one side, we removed and replaced the implants, and this is the final result. Thank you for joining us.